Hello. Now, there's one subject area that always, when it's raised, brings a lot of argument, controversy, anger, you name it, whatever. And it's vaccination. Vaccination is a topic that, whenever it's brought up, we have different sides with different opinions, different stories, and different ideas and whatsoever. But I think tonight we're here to discuss vaccination. But hopefully, we would have insights out of this conversation that would help us make informed decisions on our stand when it comes to do with vaccination. And I'm so excited to have me here, healthcare professionals. So we're not getting people who have no understanding of what this conversation is about, but we've got healthcare professionals who would sort of guide us through this whole thing about vaccination. And hopefully, by the end of this conversation, we would have broken certain myths, changed mindsets, and also giving us a better understanding in order to help us protect ourselves and protect our community. And to start off, I say, welcome, guys, for joining us on this special conversation. And I think to introduce from my extreme left, I have Abby, and then followed by Priscilla, Logan, and probably, yeah, that's right.
That's correct.
So thank you guys for joining us. But I think before we dive into this afternoon or this evening's conversation, we would want to hear just a word or two about who you are and what authority you have to be around this table to share in this sensitive conversation on vaccination. I'll explain why I say sensitive as we go along. In terms of why we talk about vaccination sensitive, it's very sensitive when it comes to this conversation. But Abby, just give us a word about.
Thank you. Yes, it's a pleasure to be here to speak with my colleagues. My role is a clinical lead for vaccinations for Kent and Medway, and I also support the Southeast region for NHS England with the vaccination program. So hopefully I can bring some of that experience to the table here and be a part of what is hopefully going to be a very good conversation.
Fantastic, Abby. And Priscilla?
Yes, I'm Priscilla Kankam, and I'm the Senior Responsible Officer for the vaccination program for Kent and Medway area, which covers about just under 2 million residents. I'm also a clinical pharmacist by background, so I think as a healthcare professional, I'm able to engage and have those conversations, bring some insights into the discussion.
Yeah. Logan?
So I'm Dr. Logan Manakam. I'm a public health consultant in Medway Council, but also a acute medical doctor in Medway Hospital. So I'm not technically leading the vaccination program in Kent and Medway, so I support really in sort of some of the implementation drives for improving vaccine uptake in Medway Council and its residents. But I've also really been closely involved in seeing a lot of patients, really during waves 1, 2, and 3, pre-vaccination program and post-vaccination program, particularly in A&E in the front line. So a lot of lived experiences about that.
Excellent. And Prabha?
Hi, I'm Prabha Vijayakumar, Head of Vaccination Workforce and Equalities for NHS England, and I look after the Southeast region, and Kent and Medway is one of our system. And I'm an occupational therapist by background, and one of my main role as Head of Vaccination Workforce and Equality is to ensure that inequality in terms of vaccination provided to everybody, to reduce that and make sure no one is left behind and everybody is vaccinated.
So it looks as if I intentionally picked Prabha to give us a last word here, because I'm sure you're all wondering, we've got a very diverse panel here from the ethnic community represented in the United Kingdom. It's intentional, because this conversation about vaccination is one thing that affects us as a community so much. And I think that's why we decided to have a conversation with healthcare professionals from within our community to come and share their experience and also to help us understand what this whole conversation about vaccination, what it's about. So yes, ladies and gentlemen, thank you so much for joining us on this panel. Now, I think many conversations like this start off from midway, where we start talking about how fast the vaccine is connected and all that sort of stuff. But I think let's go to the basics. Can any of you on this panel tell me what vaccination is all about? Maybe the pharmacists and the clinical people will help kickstart that. But yeah, anybody, we can all share. Yeah.
I mean, I'm happy to start, but I'm sure my colleagues will have plenty to add. ultimately, vaccinations are there to help prevent serious illness and disease. And I know that this conversation is perhaps centered around the COVID vaccination drive, but vaccinations are not a new thing at all. You go as far back as things like the smallpox vaccine, to chickenpox, to polio, and to the early childhood vaccinations, measles, mumps, rubella, and that type of thing. So ultimately, vaccinations are there to help reduce the incidence of serious illness. They're not foolproof, so vaccinations are not absolute, but they're there to hopefully reduce the incidence of disease and increase the health of the population.
I think adding on to what Abby says,
Yeah.
I think I know this conversation is focused on COVID, but even in the current climate where there's current issues on migrants coming through the channel, the issue of diphtheria in this unvaccinated population, vaccination or high rates of diphtheria vaccination in our UK population has been able to prevent serious illness or diphtheria actually coming across. So it's definitely a very key part in sort of protecting the health of the wider public.
I would just want to ask the question probably for yourself, probably because you're from the EDI or sort of background. But the question is that, as Abby mentioned, vaccination has been there for years and years and years, but suddenly we're seeing that there's been disparity when it comes to uptake of vaccination, and people will be asking, why now? What's the big deal? Why are we now focusing on this conversation because of COVID? Now, from your outfit, obviously, from an EDI point of view, what's been your observation, and what do you think is so important for us to take action now?
Absolutely, and I think COVID has thrown a light. I don't think the disparity have just started now or just begun now, and I think we just probably didn't know there was some disparity or how much the disparity was. COVID is almost a blessing in disguise that it has shown light on what is disparity in terms of healthcare outcomes, and certainly there are certain ethnic community groups have got far more inequality or the gap in terms of vaccination uptake, and therefore the impact of the health outcomes are quite large. I'm not exactly sure right now the exact percentage, but over the course of 2 years of the COVID vaccination program, we have seen about 10 to 20% of difference in terms of the uptake when compared to the white British, to our ethnic community background. So that's the major kind of disparity. And as kind of colleagues said, it is important because it has got quite a lot of bearing on long-term impacts and not just for oneself, but for their family and friends as well. So therefore, it is quite important for us to have a look at reducing the disparity.
Right, and I think, Dr. Logan, you're public health consultant, so which means, from my layman understanding, which means you're in the community, you're seeing the impact of communities that are not taking vaccinations. Would you like to share your experience from that?
I think fundamentally what we saw across COVID, but even before COVID, is that where lower rates were more evident in vaccination rates, outbreaks were much more common, and that led to obviously increasing risk of illness, hospitalizations, and that's widely preventable, with a good of preventative action. So it's a shame that it happened.
I just want to add that I think it's quite obvious now, because during the COVID program, we collected real-time data, so we were able to tell straight away where our gaps were, whereas in the past what we have done is done retrospective reviews and understood where the gaps were. But the real-time data gave us the opportunity to really drill down into the different communities to really understand what was going on. And I think that's why this conversation is so important, because we know, compared to our white British colleagues, the uptake in the Black ethnic minority group, the Black Africans, Black Caribbeans, is quite low.
Right. Now, I think let's sort of take a step back again and then look at the vaccine, because I think that's probably where the concern is as to how do we make vaccines? How do vaccines come about? People are talking about using animals or, pigs and things like, which obviously is goes against some other people's beliefs and religions and cultures and things like that. Can you throw any light, I mean, any of you, as to how these vaccines are developed or created?
Yeah, I mean, I can start, and
Yeah.
I'm sure colleagues will add to the conversation. You know, the development of vaccines is varied. Some of the things you referred to there around using egg cultures, using animal sort of pigs to create vaccines. In the initial stages, that was the case. There are some vaccines that are made using egg cultures, for example, like the flu vaccines, and so it is important to differentiate between different types of vaccines and how they are produced. And if we bring the conversation back to COVID, I think one of the main flashpoints has been around the mRNA vaccines. It's not something that people have heard of before, and then that leads us down the path of myth, you know, and what the vaccine can do. But you know, vaccines are made by scientists, and this process is rigorous. There are several phased trials that have to take place. These vaccines have to be approved by, you know, the regulatory authorities in the nations in which they're produced. So I think it's what I'm trying to say is to add some confidence to the conversation around vaccine manufacture. It's a very stringent process, and I'm sure we'll come to sort of the myths in a bit as well.
That's right. And I think the points that you're talking about, it's a rigorous process. It goes through a lot of trials and tests and all that, has become one of the major points that members of our community are holding on to say, how genuine is this current COVID vaccine and things like that? Because people are saying, oh, how could you develop a vaccine within a year when we still have sickle cell that we haven't found a vaccine for? We have other conditions that we're still struggling to find cure and stuff like that for. What sort of, how would you shed light on
I think the important thing to remember is that the coronavirus is not a new virus. We have other coronaviruses, which have been have allowed scientists to develop the vaccines quicker than you would normally have. The other thing, if you think about COVID and when the pandemic began, is it became a global priority. And so recruiting patients, one of the challenges, one of the delays in drug manufacture or vaccine manufacture is in getting people to join the trials. So that takes a while. But with COVID, people presented themselves much more readily than in previous iterations of vaccine manufacture. So putting all of those things together, and the fact that the mRNA technology that was used in developing some of the COVID vaccines was already available. So if you add all of those things together, you get the speed. And there was a lot of finance poured into it as well, because we had to do something. You know, we were going into a state of lockdown. You know, economies were struggling, and there are all these other factors that created the speed and the rapidity with which vaccines were manufactured. But none of that took away the quality.
Right.
If you see what I mean.
Yeah. I'd still like to always throw back, because you're the EDI person that would be looking at how to make sure that there is inclusivity in everything that we do. Now, Abby's just mentioned about how people presented themselves to be tested. And I think one of the conversations within our community, which we know and we laugh about, is we know we never presented ourselves to be tested. You understand? So how do we then justify to this community that is hesitant that we know you didn't present yourself, but you're also covered?
Yeah.
You know, and now if you say with your work as an EDI person, you need to make sure that there is inclusion. How has that impacted on your work?
And I think it's sometimes you just need to listen and engage people, not necessarily to promote the vaccination, but first of all to listen what their queries are or issues are, why they are not coming. And sometimes it could be genuinely the access problem. You know, people are really working long hours. You know, they don't get to go to the vaccination center or to the GPs during the days, in which case you need to promote, you know, access, or you might need to take the vaccination to them, having a pop-up clinic or something like that. And sometimes really, you know, different languages would be in, different communities speak different languages. They don't understand the message. So it could be just purely a language barrier. And sometimes it's just the belief system, depending on the community, depending on the religion, depending on the culture. So it's really trying to understand and having that conversation and providing the information so that people can have a informed decision to take the vaccination or not. It's not about blaming. It's not about forcing your opinion on others. It's more important to talk through, engage, and listen to people what the issues are to start with.
Right.
That's what I would say to start with.
Which then moves me to Priscilla, obviously, because that's your patch, making sure that the dissemination and availability of the vaccine and all that sort of stuff. Now, with the concerns that perhaps just raised, and we all being aware of how the community perceived this whole vaccine, how was your outfit? How are you positioning yourself to be at the doorstep of these communities?
Yeah, so right at the beginning of the program, the approach was to vaccinate en masse, so to get the vaccine out to as many people. Therefore, we created large vaccination centers. We got our general GPs involved in vaccinating, and to get as many people vaccinated as possible. The next step of our approach is taking the vaccine out to individuals who haven't come forward. So Prabha touched on the fact that we're doing pop-ins, pop-up clinics, we're doing walk-in, offering walk-in services so people can come in and have that done. I think it's absolutely important that we've done the hard work in vaccinating the mass. We need individuals to come forward to have the rest of the population to come forward. And so we are creating more access points, and the access points is flexible enough to cover, early morning clinics, late evenings, weekend appointments. So people who have busy lives can try and find a clinic to fit in. Also, we're using the data to drive this. Where we know we've got low uptake, we are taking the vaccine to those low uptake. And with that, we are providing services to address hesitancy. So there will be people around to talk to people about what are your concerns, why don't you want to cover, what can we do to support you to have your vaccine. So on an operational level, we are doing a lot of work. And I think Prabha touched on the fact it's not about forcing people to have the vaccine. It's about addressing people's concerns and making sure that they understand the importance. And I think that's why we're doing this. We really want to engage our communities to come forward.
So, Dr. Logan, maybe I would move to yours because you're in the community as well as the public. So, you were seeing this firsthand in your engagement with the community and stuff. What sort of messaging are you getting from them, and how are you also helping to sort of change mindset or encourage them to sort of think otherwise and take action?
Yeah, so I think the first thing to say is that it's not just a vaccination issue. So even during the course of COVID, when we started to implement mass testing in Medway was the first in Southeast in November, we obviously set up mass testing sites in a variety of areas in Medway with military support. But we also then realized quite quickly that our ethnic minority populations weren't coming forward to get tested from the initial data. So we set up a community champions program. But actually, a lot of that was sort of community facilitators who were already involved in the community on a variety of other health issues. So, and fundamentally, there's this disconnect between, for the most vulnerable populations we have, between the UK health services and these populations. So simple things like infant feeding, or engagement on primary care, it's a whole range of issues. And so by using this sort of really, trusted peer facilitators, we then engage them to say, well, actually come forward to get tested. We're not tracking you, if that makes sense, through testing. And then using that same message, or method, going to them about vaccination and say, well, what's your concerns? And then sort of, putting a lot of effort really in the last quarter mile in addressing that through those sort of peer champions.
Right.
Community champions.
So I'm still thinking in my head here that people, and I can hear people still saying, why should we trust this? Why should we trust this? That's being the, because yes, we're focusing on COVID. We know that our community are not responsive to vaccination in general. And suddenly they're seeing this big push for one issue, which is COVID. What are we doing about the others? The other sort of vaccination that people need to have generally as part of their general life cycle, from childhood to, old age? What are we doing around all these vaccinations? Well,
I think that there is, you see, when there is a global priority, it takes center stage. And so some of the other conversations that are in fact happening sort of in the background. So many of us work in healthcare, as you know, and the drivers for vaccination continue to happen. So elderly people are encouraged to get their shingles vaccine. These messages go directly from their clinicians to them. It may not go via the media, so it's not in the public consciousness. Children or babies, when they're born, are looked after by midwives. So their moms are well aware of when to, or their dads are aware of when to present and take their children for their vaccinations. So those conversations continue to happen, but in the background, because of the pandemic and the effects of that disease, we had, I don't know if you remember the daily briefings we used to have from Downing Street. We never had that for any other vaccine because we didn't quite get to that pandemic stage. So I think that's the only difference. It isn't more important than the other vaccinations, but those conversations are more directed to the patients from their clinicians rather than on public forums like this one.
And if I can
Yeah,
add,
sure.
so I think coming from my own experience as a clinical doctor, so obviously I sort of was very involved in wave 2, and we had the Kent variant, and obviously we were in Kent, and we had difficulty in controlling the rates very initially, compared to everybody else, and we couldn't understand why, and then we realized that. And being an acute medical doctor, sort of between A&E and intensive care in Medway, I've never seen more death, in that 1 year than I ever did in sort of 10 years. And to see every single patient coming through, it doesn't matter whether you're white or black or Asian, and you had COVID, there's nothing that would prevent that. All we could give was oxygen at that point and a bit of steroids and hope for the best. And people who really in their 40s or 50s, who really would never end up seeing in hospital, were in hospital. So I think way before that sort of vaccination came in the sort of second half of 2021, there was this massive push for that reason. We didn't want another wave like that, where so many people were dying unnecessarily.
Okay, so I think now let's turn our attention to the myths around this vaccination. We've had people out there sharing information, and for some strange reason, their voices seem to be louder than the voices of the professionals. And I think because sometimes some of the things that they say does seem like it makes sense. And I think that's why this evening we wanted to have professionals like yourself around the table for us to have conversations to see how we can clarify some of these issues. And I think one of it, which you've already answered, was it's been developed so fast, and that's. I think the other one that I've got noted here is, well, COVID is over. Why should we bother now having the vaccination? We want to touch on that, and then I've got a tall list, but we want to touch on this, and that people are saying COVID is over. Because obviously the urgency with which COVID was treated or being dealt with when we were in the height of the pandemic is no more. We're not having the daily briefings like you're saying and all that sort of stuff. So in the minds of people, we're not wearing the face mask. All the signs that reminded us of the pandemic is being taken away. So people are saying it's over. Why should we bother? So
Yeah, it's interesting. I think ironically, if you think about the reason why people are saying COVID is over, it's because a lot of people have been vaccinated.
Right.
If those people didn't present for vaccination, we wouldn't be in this current position where we're able to get some of our liberties back. People would cast their minds back to when you couldn't leave the house and you could only walk a few times a day. COVID is certainly not over. We continue to see that there are cases in healthcare settings. There are many people who have long COVID who continue to struggle with the challenges of that disease, many of who are young people. So because the daily briefings aren't happening and people, we can move about without wearing masks and so on, it's absolutely not an indication that it's over. We're certainly in a better place, but we would regress if we don't keep up with vaccinations. So I think it's important to say that.
And also, it's just to reflect on the fact that because people are vaccinated, when they do get COVID, the illness is mild. And so the COVID is still circulating, but we're not picking up the high mortality we had at the beginning of the pandemic. And so there's the assumption that, and people are not being tested as much as we tested at the beginning. So we know that it's still circulating in the system, but because Abby's just said, because of the high vaccination rate, we are benefiting from the low mortality we're seeing now and the low kind of illness rates.
You want to touch on?
No, just adding. I'm just confirming what everyone said.
Well, I want to also then add the next one with another big one is fertility. So a lot of younger women are saying that, hang on a second, let's hold off on that. We're not sure about fertility. Some are claiming they know people within their network who have been affected. So how true or false is this statement about fertility?
I think one of the things we're trying to do here is to speak to people about vaccination. So it's important to acknowledge their views, the experiences that they may have had, or friends and family. So I think it would be glib to dismiss those, but I think we can only speak from our experience and from the clinical understanding that we have. And a lot of the negative outcomes that we've seen in the healthcare settings have been from women who haven't been vaccinated. There was a review, in fact, of neonatal sort of wards and settings like that, looking at midwives and collating the number of illnesses and difficult births, and it was skewed in the direction of those who hadn't been vaccinated. So I think that's an indicator of some of the reasons why the fertility conversation is almost a futile one. There is no real clinical basis for that statement, and it's impossible to provide a 20-year review because the vaccination program is very recent. But what we can certainly hang our hats on is the fact that vaccinations in general are not a new concept, and we've seen successful vaccination drives in the past. So this shouldn't be any different.